Breast cancer is one of the leading causes of death here in Quebec, and there are actually some big gaps when it comes to treatment for young people dealing with the disease. Dr. Christian Boukaram, thank you so much for being here, as well as Deborah Bridgeman, who is a 3-time cancer survivor. We really appreciate you all being in the studio today. Can you talk to us about the new study that you've come out with and the results of the report?
There was a report that was released. This survey was done throughout Canada. And what this report was trying to do was trying to understand the needs of young patients with breast cancer. And what this report showed is that young patients with breast cancer have unique challenges and they have distinct needs for their age. And there are 5 important points that were revealed. One is that most women, which is like 60% of women, felt that after the treatments were given, they had trouble going back into their normal lives, into their normal career lives, into their normal family lives. And we would say that about 90% of these women felt the need to connect with women their own age, but not all of them were able to. And we know that when people connect with others, it's a form of support. And those who do connect benefit from it, and those who don't might feel isolated.
I was also reading that women feel that they just don't feel like they're taken seriously when they go into the doctor's office because they're so young.
There's not enough awareness that breast cancer is also, it's not only an older woman's disease, but 20% of cases are among patients that are less than 50 years old.
Right.
And there are other important issues, like for example, they had trouble navigating the health system. And also there are fertility needs that need to be addressed also.
Like?
Fertility needs, because it's one of the side effects of the treatment. It's loss of fertility,
I see.
Early menopause, loss of libido. So in a way we have gotten better at treating the disease, but we still have some work to do when it comes to caring for the person with the disease.
Deborah, can you talk to us about your personal experience? How old you were when you were first diagnosed and some of the challenges you experienced?
Well, I was 30 years old when I was first diagnosed. I was 34 when I was the second diagnosis, and I was 43 at the third. So all 3, I was pretty much in that bracket of, I was very lucky for all 3 of my cancers. I wasn't isolated. I was integrated in many different organizations. I had a lot of support from family, friends, and cancer organizations. But the third cancer, I was lucky enough to have a navigator nurse, which is one of the issues that there happens to only be navigator nurses, I believe, in Quebec. And
what is a navigator nurse?
A navigator nurse is a nurse that's assigned to you specifically, and they ensure that you are following up on all your appointments. They'll go into the rooms with you to meet your oncologist if you need to discuss.
Right. Can people request a navigator nurse?
Well, in certain provinces in Canada, there's only 2 provinces, I believe, in Canada that have the navigator nurses. Right. And this is something that the assessment report showed there was a lack of. And right. I was blessed the 3rd time to have that, which really helped me get through some things.
And Dr. Boukaram, I just want to ask, what do you think is the solution to these gaps in the system, specifically here in Montreal?
Well, what we think breast cancer is calling for, and I do agree with that as an oncologist, I think it'll increase our quality of care, is nurse navigator services. We have that in Quebec. It's something that is very, very valuable for patients. It helps them navigate through the system. And we think that all Canadians should have access to nurse navigation systems. And number 2 is the creation of national standards of care, practice guidelines for all people that are young and have cancer, especially young women, because young women with breast cancer is the leading cause of mortality for that age bracket when it comes to cancer.
Dr. Christian Boukaram and Deborah Bridgeman, thank you both so much for being here with us, and good luck furthering the study.
Thank you.